Hello everyone, welcome to A Plus Med channel. This will be the first video on this channel and I'm so excited to get right to it. Like, subscribe and please comment. The Trousseau sign of latent tetany is one of the clinical signs associated with hypocalcemia. Hypocalcemia means low calcium level in the blood. This sign was first described in 1861 by the French physician Trousseau. The Trousseau sign of latent tetany refers to the involuntary contraction of the muscles of the hand and the wrist. This is called carpopedal spasm. We'll see this in a bit. And this occurs by compression of the upper arm with a blood pressure curve. Now, the Trousseau sign could be either positive or negative. If there is a presence of carpopedal spasm, that's a positive Trousseau sign, and no spasm would be a negative Trousseau sign. It's also to be noted that the Trousseau sign could also be seen in hypomagnesemia and not just hypocalcemia. All right, so how do we elicit for the Trousseau sign? The first step would be to apply the sphygmomanometer, just like you check for normal blood pressure. Then you determine the systolic blood pressure and note this. The next step would be to inflate the cuff and elevate the systolic blood pressure for about 2 to 3 minutes. So the second step, you must have determined the patient's systolic blood pressure. So you elevate this in next step for about 2 to 3 minutes, and then you check for spasm of the wrist and the hand. So what happens is that the blood pressure curve will block the brachial artery, which is the main blood supply to the arm. And if this individual is hypocalcemic, then the arm muscles will activate involuntarily, making the wrist and part of the hand to move. All right, so this is a short clip showing a positive Trousseau sign. Here we could see the flexion of the wrist, the thumb, along with the extension of the fingers. This is a positive Trousseau sign. Why does this happen? Why is there involuntary contraction of the muscles in hypocalcemia? So normally low calcium levels, hypocalcemia will facilitate the sodium transport. So calcium ion normally acts as an inhibitor of sodium movement through the voltage gated channel. So that when there is low calcium level, that inhibition is removed, and so sodium could just flow through the gated channels and activate the muscle. On this diagram to the right, this is the neuromuscular junction, and we know that for normal muscle activation, there must be there must be movement of ion molecules through the ion channel to activate the muscle. So in low calcium level, there is hyperexcitability of the neurons because of disinhibition of the sodium movement. Okay. What are the causes of hypocalcemia? It could be caused by a variety of conditions, but it's most commonly seen in individuals with low levels of parathyroid hormone, which is hypoparathyroidism, that's a disease. It could also be seen in vitamin D deficiency. Also in diseases where there is calcium wasting, like kidney failure, acute pancreatitis, like severe infection, like treatment with medication. It could also be seen in some metabolic abnormalities like magnesium deficiency, just as we saw in the previous slide. And also acid-base balance diseases like metabolic alkalosis could be a contributing factor to hypocalcemia. All right. In summary, The Trousseau sign of latent tetany is a way to determine if an individual may have hypocalcemia. The Trousseau sign is considered positive if there is a carpopedal spasm of the hand and the wrist after an individual wears the blood pressure cuff. Okay, so there are other signs of hypocalcemia, for example, the Vostek sign. But studies have shown that the Trousseau sign is more sensitive and specific. It's present in 94% of patients with hypocalcemia and is present in only 1% of persons with normal calcium levels. So this is a very good test, better than the Vostek sign. I will talk about the Vostek sign in my next video. Thank you so much for watching this video. I really appreciate comments, likes, and please subscribe. I'll be talking about other signs of hypocalcemia and other signs in medicine subsequently.